Good day everyone! Today, we will demonstrate on how to perform post-mortem care. But, before we proceed, what is post-mortem care? Post-mortem care pertains to the physical care of a recently deceased patient, which can be done in home care facility or hospital. It is essential to prepare the body for family viewing to prevent discoloration or deformity, to prepare the body for transfer to the morgue. Always remember that before we proceed, ensure you are mindful of cultural, religious, and age-related considerations when providing this care. Now, let's get started. First thing you need to do is check the patient's chart for the physician's certification of the death of the patient. Upon doing so, always take note that post-mortem care must not be performed until the patient has been pronounced dead by the doctor. So always verify first before performing the procedure. Second, prepare the necessary materials, which are clean gloves, bath towel, 3 tags and pins, cotton, tape, cravat, shroud, diaper, and clean clothes. Next is to ask for permission and explain to the significant other that you are going to perform post-mortem care. This is to reduce the significant other's anxiety and to enhance their cooperation. Ask the family if they wish to remain inside the room during the procedure. This is to ensure that they are made aware of how the procedure is done or if they also want to assist to the care of the body. Next step is draw the curtains to provide privacy. This is to protect the patient's integrity and to show respect to the family and the deceased. Next, pour lukewarm water into the basin. This is to prepare the bed bath of the deceased. Wash hands and put on clean gloves. Even though the patient is already dead, the nurse still needs to follow universal precautions. Next, remove jewelry or any personal items of the patient and give them to the significant other. This is for legal purposes and so that the nurse will not be charged of stealing. If patient's eyes or mouth are open, close the patient's eyes, put on dentures if any, then close the patient's mouth. Closing the eyes of the deceased is showing respect and eternal rest. Then remove all equipments, tubes, supplies, and dirty linens according to the hospital protocol. Then, remove patient's clothes carefully as to not expose any body part. Even though the patient is dead, the nurse still needs to provide respect and privacy. Now, perform bed bath on the patient. This is done in order to prevent or slower the discoloration. Now, put cotton balls on the patient's closed eyes, nares, and in the outer ear. Then, secure each with tape lengthwise so that secretions in the eyes, ears, and nose will be drained in the cotton. Then, secure the patient's jaw with a cravat. This is done before after 15 to 20 minutes, the patient's jaw will be open and stiffen. Now, put on the diaper, underwear, and patient's new clothes in order to drain secretion in the diaper and put on clothes for decency and signs of respect. Give the family option to view or not to view the patient and accompany them as they do so. Compassionate care provides family members with a meaningful experience during the early phase of grief. Encourage the family to say goodbye. This is to give them time to say goodbye to their loved ones and allows them time for grieving process, as if they would like to be left alone to provide privacy. Now, attach name tag on the hand and foot. Labeling ensures proper identification of the body. Now, cover and secure patient with the shroud. Secure the shroud with safety pins. The shroud protects against injury to the skin. Avoid exposure of the body. Provides a barrier against potential contaminated body fluids. Now, secure another name tag to the shroud to ensure proper identification of the patient prior to transportation to the morgue. Now, transport patient to the morgue for embalming or autopsy. Then, document the procedure. Data from the documentation provides information about the patient's characteristics and care outcomes. Lastly, remove gloves and wash hands. And that's it. I hope this demonstration helps.